Hello everyone, myself Dr. Richa Gupta. I am a dental surgeon and also an independent medical writer. So today I'm here to give a presentation on embracing digitalization, staying ahead in modern dentistry. It is also an revolutionary dentistry. Today here in my presentation I'll be discussing about the various digital advantages and how to incorporate them in your present clinical practices. So let's begin. Digital dentistry. So, what it is? Actually, it's a wide range of dental technology which uses computer based components or uh, hardware and software, combination of both. It is called as digital dentistry. So, what exactly is the aim of our presentation? It's the goal to make it accessible to the general dentist and treat the patients using with the computer edit technology, that is digital technology. So let's begin, move further. So what are the digital technologies in present system? It's intraoral scanners. They capture the accurate 3D images. Second comes the CAD CAM, computer aided designing and manufacturing. It helps in the streamlined workflow. The 3D printing. This technology produces customized restoration, that too in a single visit. So we are saving time and multiple visits of the patients. CBCT. It provides the detailed 3D imaging for improved diagnosis and the planning. The further moving around, it's electronic dental records that facilitate for the easy access. Then comes the digital radiography. This provides high quality instant dental imaging. Then further moving on, it's come with the digital impressions. This ensures precise and efficient 3D dental scans which are needed. Like traditionally we were using impressions. Instead of that, this has been incorporated in the digital format. Further moving around are the virtual reality, VRs. How VR work over here is they engage the patient in the treatment planning and visualize the outcomes. Then further comes the teledentistry. What the teledentistry do is enhance the patient consultation and the communication between the dental team, dentist and the patients. Let's turn around more. The introduction. Now here we cannot say that we are coming into digitalization or like that. It is not any kind of future trend. It is actually happening now. Actively we are giving this presentation so that we may actively incorporate this digital dentistry into the present practical practices. Then and its successful implementation too in the dental offices. Uh, till now, still many dentists aren't using it in their dental clinics. Here I will be giving you a collective knowledge and everything regarding digital dentistry and how you can and what all things must be kept in mind and giving a brief description. So these are the variety of further digital tools. These include intraoral scanners, 3D imaging, CAD CAM, 3D printing. This helps in digitally capturing, analyzing and designing and fabricating the final custom made restorations like bridges, crowns, even Invisaligns, etc. Implants and dentures too, that can be also done here. So, looking around into the history of our digital dentistry, it already came in 1984. Here we can see the evolution of our digital dentistry. In 1984, first CAD CAM technology was introduced. Then further moving around in 1990, digital X-ray imaging came into the system, which was like every dentist started, not every, but still dentist started adopting it. It took a lot of time. Even now many places people aren't using. Then comes the on 2000 emergence of scanners was there. Then in year 2010, after almost a decade, 3D printing came into our dentistry. Then comes in teledentistry in year 2015. Then in 2020, AI integration into lodged into our um digital designing. So what is this? This is CEREC. CEREC, what is it? It's a chairside economical restoration of aesthetic ceramic like CAD/CAM system. Here all three, four things are kept in front of you. This image depicts like a scanner, digital scanner, milling machine, printing machine, and everything, dental records where we can keep our records, everything is being described in a one pictorial representation. This is a kind of setup you can keep. Digital technologies, what are the present things? Still we can see many of the dentists do not opt for it. Only 66% of the doctors are planning to invest in scanners, as these are like very expensive. Still many people are thinking about how should we incorporate into our dental clinics, will they be beneficiary to us or not, or whether moving around with the general layman traditional uh, labs only we should move around. Then we can further explore how impression is done. I'll be explaining how you can make your day-to-day practice easy with incorporating digital dentistry into your clinics. Here comes the scanning equipment. Digital dental scanners are essential for clinics and labs. Why? Because CBCT captures x-rays. Intraoral scanners, they replace the messy old traditional impressions and offer for the precise 3D images. You can like turn around and see each and every area of like oral cavity, where how much space is there, how much processes designing, how what kind of processes designing can be done based on the image, thereby enhancing the diagnosis. This is the scanner which actually replaces our traditional impression technique. CAD/CAM and digital dentistry. CAD/CAM help facilitate the workflow. Here we will be explaining about the CAD/CAM, how patient friendly it comes. It consists of dental workflow that could be handled from single place. Second, the patient from the final outcome. We can also do the corrections according to the patient and the doctor or the lab, or the changes we can do, and help a dental lab to design and manufacture the most suitable and anatomical correct prostheses in a very short period of time, and thereby limiting the number of visits. This is the complete digital workflow that is defined in a pictorial form. First in clinics, patient come in clinical forms. Then the old traditional impressions, these are like replaced by intraoral scanners. Previous traditional were messy. I will be further discussing about differences between the both. Then comes the digital designing and 3D printing and final processes. The standard digital dental workflow consists of three basic steps. First is digital scanning and digital impression. It is a procedure of a fraction of 2 to 3 minutes. And then comes the treatment planning and the designing with the use of professional softwares of CAD/CAM. A digital designing of the restoration and the treatment can be planned in the real-time revision-based feedback. Also can be taken from the patient. Right, then further comes the product manufacturing. The approved digital designs are sent to the 3D printing milling machines and everywhere, and then we receive processes in a single visit also. Then moving around the restorative dentistry. Even we can design our restorations in a digital way through the implant dentistry. You can see how in implant dentistry innovations like implant surgical guides, these ensure for the precision during the installation, while virtual smile designing can also be done. Moving around with the digital orthodontic treatment, whatever the digital dentistry or digital form can do of digital form of dentistry can help out in orthodontics. In 3D orthodontic, 3D computer visualizations can be done to create a model. Then further, these models, they enable accurate placement of braces, aligners, and other appliances while streamlining the design in-house manufacturing unit only. You may even have it in in-house manufacturing unit if you are able to do that investment. And this procedure, what does it do? It eliminate the plaster cast and thereby saving the time, reducing the risk of the damage of the transports of the cast and further time taking procedure. Digital workflow addresses for the alignment, bite corrections can be done, missing teeth restoration and growth correction can be done more precisely and with ease. How digital dentistry can put an impact on orthodontics? Let's see. What problems are being faced? Patients struggle with the discomfort during the traditional impressions, right? Solution offered, what? Utilization of the intraoral scanners instead of the traditional ones. Then benefit, enhanced patient discomfort and satisfaction during the treatment. The following workflow will provide a better orthodontic treatment. What are the different categories in the digital dental system? One comes the intraoral scans, already discussed. These are the additive technologies, right? This is the designing, pictorial representation of how you will be designing, like your restorations, crowns, and everything. And 3D printing technology. This is the printed additive crown, bridge, veneer, whatever you want to make, or a customized restoration from it. The digital smile designing, DSD. This is also one of the very good aesthetic treatment that has been continuously being done by the like dentists or dental surgeons. It's a technical tool to design and modify the smile, which helps visualize the final result even beforehand. By how? By creating a digital mock-up before the even start off of the treatment. A digital mock-up can be made and being shown by to the patient, so he will be coming around to know how the final representation will come out, like how the final processes will look. Virtual reality, already being told. Digital occlusal analysis allows for the identification of the abnormal occlusal contact points and alter the bite, which are altering that bite, right? What are the benefits of digital dentistry for the patients? Now, looking around with the benefits are engagement. Patient already gets engaged in previewing the results, participate in the treatment planning. You can also include the patient into the treatment planning, right? Second comes the precision. Precision is advanced because of this advanced technology that it is more precise, time saving, single visit. Procedures can be done in single visits too. Comfort. It is obviously much more comfortable to the patient as compared to the traditional impression taking techniques. Then comes the efficiency. Streamline procedure. Already discussed about this. It's a streamlined procedure that lead to a faster treatment timelines. Cost effective. It's a tricky question. Cost effective. How this can be a cost effective? Look, it is already in big investment, but still how we can say it's a cost effective, as digital solution lowers your material cost. You do not have to use like your impression materials and everything. In that sense, we can say it is cost effective, right? And thereby reducing the overall cost of the treatment. And foremost, the best thing is transparency. Many of our patients do not know how our treatment outcome will be, right? So here there is a transparency between the patient, they can, and the doctor, like they both can, patient can easily visualize and their expected outcomes. Like, then further comes the accessibility. Digital tools offer more engaging experience for children during their dental visits. It is very tough to treat children because they do not cooperate so easily. So with this help of digital dentistry, they can easily cooperate in the treatment. Time efficiency in dental treatments. It is single visit, rapid design. True, CAD/CAM designing can be very rapid. Streamlined process, back to back, reduced chair time, fast turnaround, and efficiency gains. Success or digital integration. How? Assessment. Evaluate the current practices to identify the inefficiencies. What are the inefficiencies? Second, training. Actually, to incorporate this digital technology, conduct training sessions for the dental team so that they can learn how to use these this technology, right? Implementation. Introduce digital tools gradually in the workflow. Slowly you can start working, getting it into the daily practices and let your team learn it. And the feedbacks, definitely feedback is necessary for anything to know how it is working, right? Comparison. How the comparison, like it's the comparison between traditional and the digital methods. Material used, they were much more messy. Like here, no material used, direct tool is used. Time efficiency, obviously longer chair time was there in traditional forms. This enables us for faster treatments and completed in a single visits. But it is very difficult for in those treatments to be done in traditional forms. Patient experience can cause discomfort and anxiety. Many of the patient get gag reflex, but here patient have pretty much more comfort and easily they can easily see what all is going around. Ethical consideration. A good thing is you always have to understand about the ethical consideration because it is digital. Then everything you are doing, it can be an ethical concern for the patient, so always take an informed consent. And data privacy, keep your data privacy, right? Then building a collaborated dental team. For this to work flawlessly, a chief dentist should be there, lead hygienist, operation manager, dental assistant, receptionist or front desk person, and patient coordinator must be there. Best practices, how they can cause a digital transition. Invest in training your entire dental team to ensure the proficiency of your digital tools, fostering how collaboration and improving workflow there of your efficiency. Establish clear protocols in integrating digital system, minimizing your disruptions and enhancing patient experiences throughout the transition process. So hope my presentation must have been understood well. Thank you.